Welcome back, everyone. We're going to dive into our lecture on tobacco use. Here we go. So tobacco encompasses a variety of substances, things like cigarettes, cigars, dip or chewing tobacco, snuff, hookah, pipes, and more these days. And the active components in tobacco are nicotine, which is the addictive component. Nicotine is a central nervous system stimulant, meaning that it increases alertness and arousal. This is a lot of what people are looking for when they consume tobacco, and that's what also makes you addicted. Tar is the combination of chemicals that are involved in tobacco that cause the various diseases related to it. And in current time, 14% of US adults use tobacco products, which is down quite a bit decade by decade as more information has come out about the health consequences of tobacco use. There are some groups that are more likely to consume or use tobacco products. Those are men, adults in the age of 25 to 64, individuals with lower education or below the poverty line. You can see by this graph that people in the Midwest and South are more likely to use tobacco products. People without insurance, medical insurance, individuals with disabilities or serious psychological distress like anxiety or depression, certain groups like American Indians or Alaskan Natives, and individuals who identify as lesbian, gay, or bisexual are statistically more likely to be groups that use tobacco products. There are a lot of health consequences, many health consequences related to tobacco products. In fact, tobacco use is considered the single biggest factor related to preventable disease and death in the United States. So some of the immediate short-term uses are less oxygen to the brain, changes in the smell of your skin, your breath, staining in your hands and teeth, frequent coughs or cold. You get an increase in heart rate and blood pressure, which will contribute to the development of cardiovascular disease over time, and less oxygen to your lungs. So this can worsen things like asthma or colds or other conditions. Long term, however, we see an increase in risk of almost every condition: stroke, blindness, gum disease, tooth loss, cancers all over the body, not just lung cancer, heart disease. Tobacco use actually causes more heart disease death than it causes lung cancer deaths. Emphysema, which is a chronic long-term lung condition, stomach ulcers, changes in the skin, bladder cancer, other cancers. It can be related to infertility or impotence, worsened muscle tone, pretty much any chronic condition that you can think of, and we'll talk about these in greater detail next week, is worsened by tobacco use. So additional health consequences that we want to hone in on: cardiovascular disease. Like I said, this is the biggest factor, disease-related factor related to tobacco use. So tobacco use increases blood pressure and cholesterol, which can increase plaque in the arteries and pressure on the heart. And this can lead to things like coronary heart disease, where the heart becomes enlarged and can't pump blood effectively, blood clots that can lead to things like stroke or heart attack, and chronic obstructive pulmonary disease, where the lungs can't get and process appropriate oxygen. It also is linked to many common cancers. So the substances in tobacco are tumor growers and producers. So it can initiate the development of cancerous cells and increase their growth and spread. 90% of lung cancer cases are caused by tobacco use, and then it's related to a number of other cancers as well. So lots of health consequences for the individual who smokes, but there are also health consequences for others. So you've probably all heard of secondhand smoke or environmental smoke, and this is smoke that comes from two sources from a smoker: mainstream smoke and side stream smoke. Mainstream smoke is the smoke that comes from the smoker's mouth as they exhale. Side stream smoke is that which comes from the end of the cigarette, cigar, or pipe, which includes thousands of chemicals and carcinogens to the individuals in the area. So it can impact individuals who are living with or around smokers. Another group that can be impacted by tobacco use is fetuses, unborn babies. So there are many impacts for the developing fetus in a pregnant woman who smokes, things like an increased risk of birth defects or miscarriage, an increased chance of premature or early birth, which can lead to health complications, increased chance of low birth weight, again, leading to health complications, stillbirth, which is when a baby is born beyond the first trimester, but is either not living at birth or does not have the capacity to live. Placental abruption, which can cause life-threatening consequences for mom or baby. So lots of potential damage smoking during pregnancy, or for individuals in an environment where people are smoking. So it's not just health consequences for the smoker. And this is actually why so much legislation has been passed that outlaws smoking in places like bars, restaurants, public beaches, schools, etc., because we can't control what people do, or we don't often pass laws to control what people do that impacts only their own health, right? There's no laws impacting what you can eat or how much physical activity you do. But when your health decisions impact people around you, then public health organizations and the government has an obligation to step in and make sure that we're living in a safe society, or safest society for everyone. So vaping is better, right? Not necessarily. Vaping is promoted as a safer alternative to cigarettes, but there's really no research to support that it's safer yet. These are newer methods of consuming either tobacco or nicotine itself without some of the tobacco substances, or marijuana. But the data on these is still pretty new. They're also posited as ways to help people quit smoking. However, many people who start using vapes never smoked cigarettes before. So it actually often works in the opposite direction, where people start vaping and then begin using other substances. And the data on it helping current smokers quit is really inconclusive. So some things to know about vaping. They still often contain nicotine, carcinogens, and other toxins and heavy metals that are dangerous to your health. Vaping is now the most commonly used form of tobacco for teens. So many of you may have tried it. I'm not saying there's anything wrong with you or wrong with that there. It's very common, but it still has these potential health consequences and toxins that are often not known about. It can increase the risk for addictions for immature brains. So at younger use, it can increase the risk of using and becoming addicted to other substances. And it impairs prefrontal cortex development, this area right here that's responsible for our logical thinking and planning. There also were in 2019 a number of reported deaths related to specific marijuana vapes, that there was something in those, it wasn't the marijuana itself, but there was some sort of toxin or bacteria that got into there that caused severe lung disease or death from these certain vapes. So of course, if you are using a vape, make sure that you are buying it from a safe source. So moving on now to the health benefits related to quitting tobacco use. It can often feel like, well, I've already smoked for 10 years or 15 years, so what's the point of quitting now? Quitting is difficult. It's really hard. It's one of the toughest addictions for people to kick. And oftentimes people who are addicted to multiple substances, multiple different drugs, including tobacco, will say that tobacco is the most difficult one to stop. People often start it at young ages, and nicotine is so addictive to the brain. However, as we see and know with our beloved Padre Tony Gwynn, it can have real life consequences. So you can see some health benefits. Within 20 minutes of quitting, your blood pressure and your heart rate return back to normal. Within 8 hours, your carbon monoxide, a poisonous gas level in your blood drops. You have higher rates of oxygen. Within just 1 day, 24 hours, your chance of heart attack decreases. 2 days, nerve endings start to regrow. Smell and taste improves. 3 days, your bronchial tubes relax. You can take in more oxygen. Within 2 to 3 months, your lung function will start to improve. So you'll notice you'll have an easier ability to perform your activities of daily living. Within 1 to 9 months, your cilia start to regrow, so your lungs regenerate and repair. Side effects like coughing, wheezing, and shortness of breath go away, and your general overall energy should increase. At 1 year, your risk of heart disease is half that of a smoker. And let's get to 15 years, your risk of heart disease is that of a non-smoker, and your risk of early death is pretty much that of a non-smoker as well. So meaning that it's never too late. 15 years from now, it could be like smoking or using tobacco never happened. There are immediate health benefits and longer term health benefits that make quitting or stopping worth it. It really is never too late. We're going to talk about more resources for quitting at the end of this lecture. We'll kind of look at all of our substances together and resources for quitting. Let's look now at marijuana. So marijuana is the dried leaves of a plant known as the cannabis plant. And this plant contains many, many different elements and components, but the two most notable ones are THC and CBD. THC is the psychoactive component of cannabis that changes your mood or mental state. And CBD, it does not have psychoactive components. It doesn't change your mood or mental state, but it has other potential health benefits for the body. So you all probably know that marijuana is legal in California, but currently illegal federally, meaning for the US. That may change, it's purported that may change in the next decade or two, but it remains to be seen. It is currently the most widely used illegal drug in the United States because it's legal here in California and many other states in the US. And it causes a variety of effects depending on the type that you're using. There are various different strains that can cause it to be a depressant, meaning that it lowers heart rate, breathing rate, nervous system activity, and makes you feel calmer. Stimulant, meaning that it does the opposite. It raises heart rate, breathing rate, and makes you feel more alert. Or hallucinogenic, that can alter your perception of reality. Now, interesting information. It's often said that people cannot become addicted to marijuana. Research shows that 1 in 10 users become addicted, and we've covered that definition of addiction in the beginning of this lecture, and that 1 in 6 users who start before the age of 18 will become addicted. However, there are some potential benefits and risks related to marijuana. So we'll cover some potential benefits, but one important thing to know is that there's really not a lot of research funding to support doing research on the benefits of marijuana or even other drugs. There are some purported benefits of other drugs and illicit substances, and there's actually some research going on in those things right now. Potential benefits for the use of certain things like psychedelics for depression, anxiety, or PTSD, where research is ongoing. But when looking at marijuana, we do see some research-proven health benefits, specifically for chronic pain. And this is a great alternative to the substances known as opiates, which we'll talk about soon. For epilepsy or seizure disorders, marijuana is often used for the alleviation of cancer treatment side effects. So the nausea or lack of appetite that comes with things like chemo or radiation. It can be used as a drug for multiple sclerosis, other conditions or drugs that suppress appetite, since marijuana typically increases appetite, and some find that it's helpful for sleep, but data is relatively inconclusive. So again, not a ton of research. These are some of the research-proven health benefits. There may be more that we're unaware of yet. However, we do see some drawbacks, just like anything in life. Some is good or can be good, too much is bad. Broccoli, some is good, too much is bad, and it's all going to be dependent on the individual. So some of the drawbacks or health drawbacks of marijuana are reduced IQ function when started younger than the age of 18. So you'll recall that I said it can negatively impact the prefrontal cortex. It is associated with an increase in depression, anxiety, and psychotic episodes in some. So that's the tricky piece, is that often people use it for depression or anxiety, but much of the research shows that it can worsen these conditions long term. It can negatively impact athletic performance, slow reaction time, and impair coordination. So there may be an effect for driving for some people. We don't know, or there are no laws necessarily around testing it yet. I believe you're not supposed to use marijuana in states where it's legal when driving, but they can't blood test it like they can with alcohol. But know that it can slow your reaction and impair your coordination, which are crucial for safe driving. There can be teratogenic effects, which means that there are effects on a growing fetus in a woman who's pregnant. So it can impact fetal growth. It can lead to premature births or low birth weight births, which we already covered can be risky for the baby. It can lower the cognitive function in babies and increase the risk of stillbirth, which we defined as well. It can potentially increase the risk of lung, heart, or blood vessel damage because of the smoking behavior, and it can negatively impact work, school, or social life in regular or occasional users. So you see that there are some health benefits and some health drawbacks. So it's important to weigh the pros and cons for yourself personally when considering whether you'll use this substance. You'll also get to take a test this week, actually from the San Diego Community College District, that helps you assess your own marijuana use and knowledge. And if you don't use marijuana, it's okay, you can still take the test. Let's move now to caffeine. This is a drug. People often forget it, but it is often touted and is likely the most commonly used drug in the world. I use it every day. It is a natural stimulant that's found in many plants and products. And by stimulant, I mean that it is a central nervous system increaser. So it increases heart rate, blood pressure, alertness. And it's found in things like coffee and tea, which you're all probably familiar with, energy drinks and soda, and even in things like chocolate, which I sometimes forget in the evening. Like I said, it's likely the most commonly used drug in the world, and it blocks a specific neurotransmitter, kind of like a brain hormone, that makes you feel tired, allowing you to feel more energized, and increases that sympathetic nervous system activity. So there can be some mental or physical health benefits from caffeine, but just like anything, when there's too much, there can be some drawbacks. So some various potential effects: increased alertness and focus, which is what many people use it for. It increases urination because it's a diuretic. It can make you feel jittery or anxious, and the amount required to get you to the state varies depending on the person. It can interfere with the absorption of certain minerals, like iron in particular. It can increase your blood pressure, heart rate, and breathing rate, possibly make you feel dizzy or dehydrated. If you consume too much, it can lead to nausea, vomiting, or headaches, anxiety, difficulty sleeping. That's why our article recommended cutting it off at noon, or for some people at the latest at 2 p.m. It can worsen heart arrhythmias in individuals who have pre-existing conditions, and of course create a dependency just like any other drug. So some possible benefits for focus, mental clarity, some possible drawbacks around anxiety, physical effects, and sleeplessness. There is research to show that it can also improve athletic performance. If you go cold turkey or you're regularly consuming caffeine and you stop, you might feel some withdrawal symptoms. This includes feeling tired because it's no longer exerting its regular function, headaches, nausea, difficulty concentrating. You may feel irritable, have various hormonal changes. However, you may notice that your sleep improves and you get reductions in anxiety. So I've actually noticed many students talk about, when we covered sleep and stress, that changing their caffeine intake can improve these things. Okay, we're going to look finally to opioids. Now, opioids are a major public health epidemic. Opioids are a class of drugs that have a variety of effects. They're often used as pain relievers or painkillers, but they also have a euphoric or relaxing effect associated with them. So if you've ever had a surgery or major procedure and they've given you a painkiller after it and you notice you felt sort of calm or loopy, that's the effect of an opioid. Opioids are found in common painkillers or painkillers that doctors would prescribe, and also in street drugs like heroin or fentanyl, which is a medical drug that's also found on the street. It is a highly addictive substance, and tolerance can develop really quickly, which is an important thing to know as we move forward here. So you get this pain relief, these euphoric feelings, you're feeling good, and you can become addicted very quickly. Cool. So the reason it's a public health epidemic is because in the early 1990s, drug manufacturers started producing painkillers. And they assured doctors that these painkillers would not lead to addiction in their patients. So doctors heavily prescribed these things for acute and chronic pain. Acute pain being pain that lasts for 3 months or less, chronic pain being pain that lasts for longer than that time period. So maybe after surgery, a broken bone, or for something like chronic back pain or other chronic pain. Doctors started heavily prescribing these things, and like we already covered, they're very addictive. And this led to widespread addiction in the US. So you can see this chart here from 1999 to 2019, the deaths related to opioid overdose. So in addition to being heavily addictive, opiates can lead to overdose and death, depending on the drug in varying amounts. So you can see that they have the rates of deaths related to commonly prescribed opioids, so like painkillers, heroin, and other synthetic opioids that are used for medical purposes or manufactured illegally. And you can see that the deaths begin to rise from these prescription opioids. But as people no longer had access to their prescription ran out, or as the medical industry has begun cracking down and tightening up the prescription of opiates because of this epidemic, you see an increased rise in heroin or other synthetic opiate use and death. So some interesting facts. 20 to 30% of people who use opiates misuse them. That's the medical use of opiates. Up to a third misuse them. 8 to 12% of people who are using opiates for chronic pain develop an addiction, not because there's anything wrong with these people, it's because these drugs are addictive. And a hugely important statistic, 80% of people in the US who use heroin started with prescription opiates. So we often think of heroin as a street drug that, you know, people who don't have their life together use. It's not true. People who are using medically prescribed drugs for medical conditions are then so addicted and they don't have access to their medication anymore that they end up using heroin. And 70% of the drug-related deaths in the US are caused by opiates. So this is a big problem. You can see some of the statistics on overdose deaths here in the US in the last couple of decades. And the way that opiate causes death is that it impacts the brain region that controls your breathing. And some symptoms you might notice are pinpoint small pupils, lack of consciousness, or difficulty breathing. Fentanyl is now the biggest opiate killer. It's a cheaply and easily made opiate that is much, much stronger than heroin. You can see the small amount on a penny there that's required to cause a fatality. And it's often found in heroin or other opiates now that people don't know that it's there. So this is the new leading killer of the opiates, and it is here in San Diego County. One important thing to know about this is the drug known as naloxone can reverse the effects of opiates, potentially saving someone's life. So if you know someone who uses opiates or is at risk of overdosing or has overdosed, you can keep naloxone on hand. You can actually get naloxone prescribed, or they can get naloxone prescribed from their doctor. You can often get it at community health clinics free of charge. Ambulances keep this on hand to reverse the impacts of an overdose and potentially save life. You're also going to explore some other substances this week using the NIH, National Institutes of Health, commonly used drug chart. So we're not going to go detail by detail through every drug and substance there is. The DARE program data has shown us that that doesn't work to improve health. So generally, fear tactics are not helpful in getting people to improve their health. They just cause stress and anxiety, and sometimes even cause an increased use of the undesired behavior. However, you will be able to explore some additional substances on your own and just learn about them. You'll be able to learn what they are, where they're from, their effects on the body, and their potential health drawbacks, detriments. So I encourage you to explore things like cocaine, MDMA, methamphetamines, steroids, Rohypnol and GHB, which are date rape drugs, and any of the other commonly used drugs seen here. Lastly, let's cover some resources for support. So some local resources include things like the San Diego County Prescription Drug Abuse Task Force. These are all links. So if you go to the PowerPoint, you can follow the links there. This website will take you to treatment resources in San Diego. You can also call the number listed here or 211 to get additional information about residential and other drug treatment options in San Diego County. And you can go to the Behavioral Health Services website to find other treatment resources in San Diego County. SAMHSA, the Substance Abuse and Mental Health Services Administration, has some national level resources for you and additional information. And if you're in a mental health or substance related crisis, you can call the number listed here, or if you know someone else who is in a mental health or substance related crisis. Now, some resources specific to tobacco and alcohol. The CDC, the Center for Disease Control, has resources related to quitting listed on this website. They have a bunch of resources. They have apps that can help you quit and with quitting protocols, texting programs that can text you reminders, resources for social support, medications that can help with like things like tobacco withdrawal, and resources for making a plan. Smokefree.gov has similar resources. The NIH Treatment for Alcohol webpage has information, links, and other resources for help around alcohol addiction. And then lastly, we have Alcoholics Anonymous and Narcotics Anonymous pages to find local chapters if you're looking for resources and social support near you. And remember, social support is key for our health and for overcoming some of these challenging addiction conditions. So our major takeaways for this module. Addictions are biopsychosocial conditions that have many contributing factors. Again, biological, so our nervous system, our genetics, psychological, thoughts, feelings, situations, stressors, etc., and social, our environment, the family we grew up in, our workplace, all of these things contribute to the development of addictions. And social support and connection are so key for our health and well-being that when we lack those things, many times we will turn to the addiction of some substance or behavior to soothe ourselves. Shame, blame, and guilt don't elicit change. If you know someone who's experienced addiction, or you have or are experiencing addiction, get rid of that stuff. It's not useful, and we all have some vices. You'll see one of my favorite quotes in the overview for this week's module from John Steinbeck that says something to the effect of, all of our vices are attempts to love and be loved. So all of the poor decisions that we make, the silly things that we do that harm ourselves are just attempts to find and create those feelings of love and connection. So please give yourself a break and use some of the resources listed here. Lastly, it requires multifactorial support, empathy, and connection to move forward. Don't go at it alone. All right, I hope you found this interesting, informative, and useful, and that you enjoy exploring our additional resources this week. Take care.